Think about what you did the moment you got out of bed or off the couch today. Did you put all your weight on your knees, push up with your hands, and feel that familiar sharp ache? The way you stand up from a chair might actually be putting massive, unnecessary stress on your joints, triggering pain and inflammation every single day. Welcome to Rehab MD Insights. I'm Dr. Matthew Rhodes. And while I am a doctor, I am not your doctor. Please remember that this video is for educational purposes only and does not replace personalized medical advice. Today, we need to have a serious talk about your knees. If you've been told you have knee arthritis, or if your joints simply ache when you take the stairs, you are in the right place. Let's explore how to protect your joints and get you moving comfortably again. Let's start by understanding what knee osteoarthritis actually is. For a long time, we used to tell patients it was just a wear and tear disease, simply the mileage of a life well lived. But modern medical science shows us a different picture. It's actually a complex condition. Yes, there are changes to the cartilage over time, but there is also a low-grade inflammation happening inside the entire joint. It affects the bone underneath, the lining of the joint, and the fluid inside. When the joint gets overloaded, this inflammatory process speeds up, and that's when the alarm system goes off. Many of my patients ask me, if cartilage doesn't have nerves, why does it hurt so much? That is a fantastic question. The pain doesn't come from the cartilage itself. It comes from the bone underneath, which is packed with nerves, and from the surrounding tissues becoming swollen. Feeling pain after a long walk is your body's response to this inflammation. It's trying to tell you to protect the joint, but protecting it doesn't mean stopping moving. In fact, sitting still is one of the worst things you can do for arthritis. So, how do we stop overloading the joint? It starts with how you stand up. Most people sit too far back in their chair, keep their feet close together, and try to pull themselves up using just their knees and lower back. Instead, I want you to use the nose over toes rule. Here is the step-by-step breakdown. First, scoot to the edge of your chair. Second, bring your feet back slightly so they are flat on the floor, right under your knees. Third, lean your torso forward from the hips until your nose is directly over your toes. By doing this, you shift your center of gravity. You engage your strong hip muscles and your core, taking the heavy lifting completely away from the delicate knee joint. Push through your heels and stand tall. To further support that joint, we need to strengthen the muscles around it. Think of your thigh muscles, the quadriceps, as the shock absorbers for your knee. The stronger the shock absorber, the less impact the joint takes. Here are 3 simple, zero-impact exercises you can do every day. Number 1, the seated straight leg raise. Sit in a chair, slowly straighten one leg out in front of you, and squeeze the thigh muscle tightly for 5 seconds. Slowly lower it. This builds the quad without putting any weight on the joint. Do this 10 times on each side. Number 2, heel slides. Lie on your bed or the floor. Slowly slide your heel toward your buttocks, bending the knee, and then slide it back out straight. This helps circulate that natural joint fluid and maintains your range of motion. Number 3, the supported mini squat. Hold on to the back of a sturdy chair for balance. Bend your knees just slightly, no more than a few inches, and stand back up, squeezing your glutes. This trains your muscles to handle your body weight safely. Now, I want to be completely upfront with you. There is no magic cure for osteoarthritis, and the exercises and strategies we just covered will not magically regrow your lost cartilage. However, they are practical, proven tools to help you manage your symptoms, reduce daily flare-ups, and keep you moving as comfortably as possible. Living with some stiffness is common, but you shouldn't have to suffer. You need to call your doctor if the pain starts waking you up in the middle of the night. You should also seek help if your knee suddenly swells up significantly, feels hot to the touch, or if it suddenly locks or gives out while you are walking. These are signs we need to evaluate you further. When you see a doctor, know that joint replacement surgery is generally a last resort for advanced disease. We have several conservative options. We often use specific unloading braces to physically shift your weight away from the most painful part of your knee. We also offer specialized injections. Besides cortisone for rapid inflammation relief, we use viscosupplementation, which is a hyaluronic acid gel, or PRP, which uses healing factors from your own blood. Now, to be completely clear, these injections do not regrow lost cartilage, and they don't work the same for everyone. But for many patients, they can significantly relieve pain and improve function for months, giving you the window of opportunity you need to do your exercises and get your strength back. Your knees have carried you through your entire life. With the right movement strategies, you can take control of your joint health. Try that nose over toes trick tomorrow morning and let me know in the comments how it felt. If you found this helpful, please subscribe to Rehab MD Insights. Share this video with a friend who might be rubbing their knees right now. I'm Dr. Matthew Rhodes. Stay active, stay hopeful, and I will see you in the next video.